So before I talk about the estrogen therapy, so we need to understand how the therapy works. Okay, so estrogen is like a growth signal. So you have to bind to the estrogen receptor. Yeah, it's like the first figure here. So the estrogen binds to the estrogen receptor and cause this protein to form with another same protein. And then this protein will go to the, from the cell surface, go inside the nucleus, and then we turn on, ask the DNA to make a lot of RNA, specific RNA, yeah, only specific region. And then those RNA will make protein, and then the protein will help the cell to grow, keep growing, right? So the assumption is, if the cell expresses estrogen receptor, then this pathway must be activated. If we block this pathway, we should stop the cell from growing or slow it down. Yeah. But so that's the reason, because this requires the receptor and the estrogen, yeah, or call it estradiol, yeah, the name of the estrogen. So one way to stop the synthesis of estrogen is because the body makes the estrogen, but require a lot of biochemical reaction. So one of the reactions require an enzyme called aromatase. So like lactosol is an inhibitor, inhibit the aromatase, so that the cell will make less estrogen. Yeah. So although the estrogen can be made from fat cell, mostly from the ovary, right? So that is how the lactosol work. But like the tamoxifen is different. Tamoxifen is a molecule very similar to the estrogen. Yeah. So that it kind of competing with the estrogen, but it has a higher affinity. So you bind to the receptor, like here. This is a tamoxifen molecule, but when you bind to the estrogen receptor, it will not activate both the DNA binding and then, so you will not activate the protein properly. Yeah. So that even the receptor bound to the DNA to turn on the signal, it turn on only some of the signal, not able to fully turn on the signal required for the cell to proliferate. So that's how the tamoxifen and the works. And finally is the fulvestrant. Fulvestrant is different. So it also binds to the receptor, yeah, bind to a different way, but it will cause the receptor undergo some degradation, trigger another pathway to destroy the receptor. So you have no estrogen receptor, of course the downstream signal will all shut off, right? So my hypothesis is probably for some low grade or most low grade, maybe both pathways are operating. Some receptor may not require the estrogen. So we don't know yet. I think the fulvestrant probably will give better result than the other two, but maybe from the study ongoing, maybe we can get an answer. Yeah. Or I think Dr. Gerstensen mentioned one time maybe we can combine two hormone therapy together. Or I think Dr. Sun is also looking at the patient who have been treated by multiple hormonal therapy and see whether we can get a clue this is something feasible.